Introducing Hawaii Living with Ann Lee, a culinary journey through paradise, offering viewers an intimate look at the people, places, and flavors that make Hawaii truly special.
On this episode of Hawaii Living with Ann Lee, we take a different approach and feature non-surgical aesthetic procedures which have become very popular but are often kept private. Dr. Jeff Healy, a board-certified plastic surgeon, is one of the most respected in the state. He also has a med spa in Aiea and just opened a brand new location called Skin Lab in Honolulu. I head over to Healy Plastic Surgery at Pearl Ridge Office Center and walk you through the full doctor-patient process from consultation to treatment planning, offering an inside look at what sets Dr. Healy apart in the field of cosmetic surgery in Hawaii.
Hi, Ann. Nice to meet you.
Nice to meet you.
Today.
No, I'm very excited.
Have a seat. Glad you're here.
I wanted to do this because I know that you're known for your plastic surgery. And before we continue, I want to know the difference between a plastic surgeon and a cosmetic surgeon.
Okay. Yeah, it's a great question we get all the time. So, plastic surgery is really the only surgical specialty recognized by the American Board of Medical Specialties. So, to become a plastic surgeon, board certified, you have to do several years of surgical training and residency, 6 to 8 years typically. Then you have to do oral examinations, written examinations, a very strenuous process to be a board certified plastic surgeon. There are a lot of pretenders out there that want to do this type of surgery, but they don't want to go through all the training, so they call themselves cosmetic surgeons.
I see.
So that's the difference.
So when you're looking for someone, whether it be for enhancements or injections and things like that, you want to go to a plastic surgeon.
Yeah, a board-certified plastic surgeon.
Board-certified plastic
That's
surgeon.
the distinction that sets us apart.
Okay, thank you for that distinction. I know you're known for making women beautiful all over Oahu. I wanted to meet with you because there's so many people in Oahu that do this, but you're in Aiea.
Right.
And you've been here for 20-something years?
20 plus years, yes.
And so people, you service, like, I want to say, the next half of Oahu?
Yeah, we pull patients from all over the island, but a lot of the growth is out on the west side, Kapolei, Eva Beach area, so it's easier for those patients to come here as opposed to going all the way into town.
Yeah.
Like that. So it's a great location for us, actually.
So I'm very curious because as someone that eats a lot and kind of doing this, for a couple of years now in front of the camera, I do notice a couple of lines here and there on my face, and I'm very curious, and I'd love to get a consultation with you because not only do you do surgery, but you also do aesthetics.
Right. So, yeah, the non-surgical side, what we do involves a lot of neuromodulators, fillers, skincare, facials, things like that. So it's really important for anybody to, what we do what we call preventive maintenance. So you don't want to get so far down the road that you need a facelift to look presentable, where we can do smaller non-surgical things in the meantime to keep you looking healthy and vital, and so we do that as part of our non-surgical treatments.
So it's like preserving, in a way, preservation.
Right, maintaining your youthful beauty. That's what we're trying to do.
The other thing is, walk me through the process. So I know when I made the appointment, I met with the receptionist. What other parameters do I need to do before I go ahead and book a consultation with you?
Yeah, basically we like our patients to do their homework, so check us out online, look at our reviews, look at our website, and then call to schedule your consultation with us. We will have you fill out some forms online ahead of time just so we have your medical history and things like that. And when you come in to meet us, we sit down and talk just face-to-face initially just to get to know each other a little bit better. You want to feel comfortable with your doctor, and so that's part of getting to know each other. I review your medical history, see what medications you're on, if there's any allergies, things like that. And then basically I just ask you what bothers you, what do you want to improve, what do you want to treat, and I never like to oversell things, so I'm not going to say, oh, this and this and this. I don't do that. Okay. I listen to my patients and do what they want to do.
Okay, so we're going to go, and I'm going to have you do a consult on me. Is there anything else you want to share about the practice, how to book appointments? I know you're super busy, so it's hard, to get an appointment with you. So how do you encourage people to book a consult?
Yeah, so either go online or call us to book a consult. We have a lot of other providers here too, besides me. I concentrate on the surgery for the most part.
Yeah.
So I have 2 other nurses that do injections, the neuromodulators and the fillers. We have several estheticians that do the facials and chemical peels and things like that. So we have multiple providers that can service our patients, and so it's relatively easy to get into those other things. Surgery takes a long time to get into, just our schedule is so full and backed up, and so
there's only one of you.
Right. So we never like to rush things. We want to do it properly and take our time to do it right. So that's how we do it.
Now, do we want to share like the future of what's happening in the aesthetic world in this in Healy Plastic Surgery?
Sure. So we are in the process of opening up a second location at Ala Moana. It's going to be a skin lab.
Wow.
So it's in conjunction with SkinCeuticals, and that will be a location where I don't do surgery, but we'll offer all of the non-surgical things. So a lot of retail SkinCeuticals brands, very popular worldwide. And then we'll do all the esthetician treatments, the injection treatments. That'll all happen at Skin Lab, and that's supposed to open up in December.
So that's like really soon.
It's happening.
That's
right
like
around the corner.
that is like the secret that just got out.
Right.
Okay, we're going to take a quick break, and then we're going to go into your, what do you call that? Your magic room?
Treatment room. Treatment room.
Okay, we'll be right back.
Okay.
So it's going to come down to this.
Can they do it?
Oh no, they missed it! Wait a minute! There's a flag on the play!
All right, pop quiz, guys. Do you ever wonder how farm fresh ingredients get from the farm to the restaurant? You probably don't think about stuff like that, but that's all we think about. But we're not a farm, and we're not a restaurant. We're the guys who connect the best local products to the best restaurants. We search out new food trends, help with menu options. We're Cisco, and you probably don't know everything we do. But your favorite restaurant? Yeah, they do.
Okay, I am back with Dr. Healy, and he's going to analyze my face.
Yep. Yeah. So first thing I always do is I want to ask the patient what they see when they look in the mirror, what they see bothers them, what do they think they need some help with, and so we kind of start there, and then I do my top to bottom assessment and make some recommendations.
Well, I definitely see like this in here getting more hollow. I do this weird thing with my mouth. I clench my teeth at night, so I'm getting these weird lines down here.
Okay.
For the most part, my mom blessed me with good skin, but it's just like the little like dots and marks and things like that, But yeah, just to keep and restore the youthfulness, I guess, is really my intention.
Sure.
I do get some weird lines up there.
We all do.
But just like really, because I feel like I have this permanent frown.
Okay. So let's talk about it. I'm going to have you look in the mirror, and I'll kind of show you what I'm looking at as we go through. So we'll kind of start with the forehead, and we'll work our way down. So here at the forehead, I'm looking at the transverse lines here. So go ahead and raise your eyebrows up. So when you raise your eyebrows up, you're activating the frontalis muscle. That goes from top of your eyebrows up to your scalp, and that gives the transverse lines here. So this is a very good area to use neuromodulators, kind of smooth out some of these lines. Go ahead and frown for me, look angry. Okay. So these are what we call the 11s, these vertical lines. These are caused by different muscles, the corrugator muscles. Those go from the top of your nose to your medial eyebrow. So when those contract, you get these vertical lines like this. Another very common area we use the neuromodulators. Give me a big smile. Okay. So here we're looking at what we call the crow's feet. And yours actually aren't bad at all, but this is the orbicular oculi muscle that comes around here, and that gives these transverse lines out here. So we can do a little bit there as well. And then kind of crinkle up your chin for me a little bit. Okay, so the mentalis muscle causes kind of dimpling in the skin, so we can soften that with some neuromodulators as well. Okay, so forehead, glabella, we'll do the neuromodulators, a little bit in your crow's feet. I always look at the eyebrows, the eyes. Your eyes are beautiful, look really nice. A little bit of hollowness down here, but not bad. I wouldn't do anything major here right now. You got great cheekbones, which is
It's a Korean
yeah,
thing.
Korean thing. So beautiful, nice and full there. These are what we call the nasolabial lines here that come up the side of the nose. These get a little bit deeper as time goes on because gravity's pulling the tissues down from our cheek, and they pile up right here. Yours aren't bad, and you don't want to take these away completely because it looks unnatural. Okay, so that's not bad. And then here off the corner of your mouth is what we call the marionette lines. These tend to get deeper as we get older as well. Gravity's pulling things down. You start to get some jowling here. So we can do some fillers in here to kind of soften these lines as well. A little bit of neuromodulator here to help the corner of your mouth come up a little bit too. That'll be really nice. And then go ahead and clench for me. Okay. So I'm feeling your masseter muscles here. So it's another popular place where we put neuromodulators to help just soften the bulk of the muscle there and give you a more V shape to your face. Let's do some pictures. Just kind of give you a pre-treatment photo. So I'm just over here in front of the screen, if you would. Okay, let's go to this part right there. Perfect. Okay, 1, 2, 3. Okay, now I want you to raise your eyebrows up high. Okay, frown for me. Look angry. Okay, give me a big smile. Perfect. Okay, so we go for our baseline. You seat there. I'll go get the products we're going to use, and we will get to work.
Okay.
Do you want numbing cream?
I should probably, yeah.
I think so. No, let's so let me put some numbing cream on, and then we will. There, okay. So maybe just here on the lower part of your face.
So you don't mark up the face,
No.
because you know where you're going
I
to
just do
stick
it.
the needle.
I do it. Yeah. Looking at the patient and having you animate, move your muscles and stuff like that. That's all we need. Okay. All right. That's it for a few minutes. I'll be back.
So it's going to come down to this.
Can they do it?
Oh no, they missed it! Wait a minute! There's a flag on the play!
All right, pop quiz, guys. Do you ever wonder how farm fresh ingredients get from the farm to the restaurant? You probably don't think about stuff like that, but that's all we think about. But we're not a farm, and we're not a restaurant. We're the guys who connect the best local products to the best restaurants. We search out new food trends, help with menu options. We're Cisco, and you probably don't know everything we do. But your favorite restaurant? Yeah, they do.
So, Dr. Healy, can you explain to me the level of pain that I'm going to be experiencing?
Yeah, it was a bit different. It's usually not that bad, to be honest with you. The neuromodulators of Javoux, I use a 33 gauge needle, a little tiny needle, so really not bad at all. You may feel a little poke here and there, but she's not bad.
Okay.
The filler's a bit bigger needle, so that's why I put the numbing cream on there. So you may feel a little poke here and there, a little bit of pressure when the filler goes in, but it really shouldn't be that bad.
Okay.
And then overall, very safe procedures to do. Every treatment has potential side effects, so you just need to be aware of that. Most of the side effects are related to the actual injection itself. So the needle going into your skin, maybe a little bit of redness, a little bump that'll go away very quickly. Sometimes you get a little bit of bruising if we hit a blood vessel. We're trying to avoid that, but sometimes you can't see them. So basically that's it. The fillers, once I put it in, I'm going to kind of massage it to smooth it out because we don't want any lumps or bumps there. And overall, very, very safe procedures.
Okay.
Okay. All right. So we'll wipe out this numbing cream. Had some time to work.
When would you say is a good age to start this type of treatment?
Yeah, we're seeing a lot younger patients nowadays doing it. Again, it's all about that preventive maintenance. Easier to treat when you're young and just preserve that beauty. If you get too far down the road, it's harder to correct things. And so we have a lot of patients in their 20s actually, they're doing the neuromodulators.
Really?
Yeah, so that's just want your skin nice and clean before we put any needles in there so you don't get an infection. So go ahead and give me a big smile. Okay, so we're going to see where the muscles contracting. So I'm going to inject the product, so then just relax, okay? There's always a lot of little veins throughout the side of the eye, so we're trying to avoid those. Sometimes you can't see them, but we'll avoid those. So a few little pokes right here.
I can't really feel it at all.
Yeah, it's a really small needle, so it's usually not bad at all. Okay, and then I like to massage it in after the injection. Poke here. Okay, that's the crow's feet. Not too bad.
No, not at all.
Good.
So what do I have to do after the procedure to keep?
Yeah, really for this, there's really minimal that you have to do. I just tell patients that don't do any real strenuous exercising for like the first 24 hours, and that's it. Really.
That's it?
That's it. Yeah. So pretty easy to do. Okay, so do your glabella and forehead next.
So with this type of maintenance, you could really like sustain your face for a long time.
Yeah. So that's where you like the preventive maintenance terminology that comes in there. So, okay, now we have you frown. Okay, I want you to keep frowning like that. Hold that pose, okay? Do you feel pokes here in your glabella? Poke. These are called the DAO muscles. Clench for me.
So it's going to come down to this.
Can they do it?
Oh no, they missed it! Wait a minute! There's a flag on the play!
All right, pop quiz, guys. Do you ever wonder how farm fresh ingredients get from the farm to the restaurant? You probably don't think about stuff like that, but that's all we think about. But we're not a farm, and we're not a restaurant. We're the guys who connect the best local products to the best restaurants. We search out new food trends, help with menu options. We're Cisco, and you probably don't know everything we do. But your favorite restaurant? Yeah, they do.
Thank you for joining me on this journey. I hope you found it as interesting as I did, and it answered some of your questions about aesthetic procedures. My experience was meant to give you peace of mind and the confidence if you're considering your own journey. Now here's the final phase of my procedure with Dr. Healy. Aloha.
Look at your jawline here. I'm going to do a little bit right in front of that jowl area to build that up, and then we'll kind of go up and get the marionette line as well, okay? So, I'm going to poke right here. This is going to be pretty deep. Doing okay?
Mm-hmm.
So just a tiny bit. Okay, another poke. right on the bone actually to build that up and soften that pre-gel sulcus, we call it. Just kind of helps that blending in of the gel towards the chin to smooth out that line. Looks good. All right, now we'll kind of come up here more superficially into the marionette lines. Okay, I'll poke right here. Doing okay, pain-wise? The Restylane has lidocaine mixed in with it, so as it goes in, it's going to numb as well, so makes it more comfortable. Okay, so we're just kind of lifting up the corner of the mouth a little bit with that, and smoothing out that line. I'll massage it in just a minute. That's
So what's the
good.
difference between like a Botox or whatever that is versus a filler?
Yeah, so Botox and neuromodulators, Jeuveau, they work on the muscles too. They weaken the muscle; they can't contract as strongly, so they work well for what we call an animation problem. So when you raise your eyebrows up or smile, those lines are caused by the muscles. That's what the neuromodulators work on. The fillers are designed to add volume back to the face.
Okay.
As we age, we lose volume, and so this restores that volume, gives a more youthful look. So they're different products, but they work hand in hand.
They
all
work
the time.
well
So
together.
work well together, exactly. Okay. Poke. Okay. So you can already see the corners of the mouth are coming up a little bit. So now I'm put a little bit more just in that kind of oblique line that's there on both sides. But you're doing great.
It's all about the injector.
Poke. To the other side. Poke. All right, looking good. I'll massage that in place. So I do this just to kind of smooth it out, so it's nice and smooth appearance. You'll still be able to feel the product in there if you rub your finger along it, but as long as it looks nice and smooth, that's what we want. Okay. Okay, finishing touches. I'm going to put some HA intensifier on your skin. So this is a SkinCeuticals product as well. So HA stands for hyaluronic acid. So the fillers we use are hyaluronic acid fillers. This helps to preserve them so they don't break down as fast. Also helps your body make its own hyaluronic acid. So it's a really great product to use after fillers. Really anytime. It's a really good moisturizing product for your skin. guys don't typically use a lot of skincare, but this is one that I actually use myself every day.
Really?
Yeah, it's really good stuff.
Just use this as like a serum.
Yeah, it's a nice serum, very good moisturizer, and again, helps your body make its own hyaluronic acid. Help your results last even longer.
What is hyaluronic acid? Am I saying that right?
Yeah,
What is
hyaluronic
that
acid,
too?
yeah.
I know
So
it's
it's
very
found naturally in our
popular.
bodies. It's actually a sugar that's in our bodies, but that tends to break down over time, and that's what causes that volume loss to occur.
Oh, wow, okay.
So yeah, it's a really good maintenance. Okay, beautiful.
Wow,
Looking good.
there's no holes in my face. Well, you know, I wanted to do this because I didn't want people to think that they had to feel ashamed.
Right.
Or, you know, this is something that people should come in to do to make themselves feel better.
Exactly.
I mean, in Asia, they're walking around with bandages. In Korea, they
Oh,
they
yeah.
get
You go to
plastic
Korea,
surgery for
such a big thing.
graduation.
Exactly.
So I just wanted people to, you know, if that's something that they want to do to make themselves feel better and do something good for themselves, why not?
Exactly. Yeah, the stigma of plastic surgery has really gone away a lot, which is good. And people should feel comfortable, know they can do very safe, easy treatments and just preserve your beauty, make you feel better about yourself inside. And
Well,
that goes a long way.
We're gonna track the progress. And I thank you so much for doing this.
Oh, thank you for coming in.
Okay, so
Great to see you.
Healy Wellness Institute, is there a website?
HealyPlasticSurgery.com. is the website,
HealyPlasticSurgery.com.
yeah.
You can go online, book your appointments, or call.
Right.
And you got an amazing, wonderful, friendly team.
Really good team.
Yeah.
We'll work well together, so take care of our patients.
Awesome. Okay.